Hi, happy Monday. Thanks for joining. We are delighted to have you. What a conversation we have today. So first and foremost, just want to thank everybody for attending. Nice on this Monday morning. Thank you, Jarrow, for hosting this panel. Thank you to our panelists that are here. And really just super excited to broach a conversation. In fact, I had a team member sent me the nicest note this morning, and it really, without pressure, at the same time, I feel like I'm speaking on behalf of half the population, or at least asking questions on half the population today relative to vaginal health and all the difficult questions that perhaps I know for me and my generation, we grew up without Dr. Google or the internet, I love you, Mom, but without parents that gave us a significant amount of information, specifically as it related to vaginal health or sexual health or things that would make an impact on our overall well-being that were mostly considered taboo. So I'm very happy to be having this conversation. I hope it's the first of many. And, thank you to each of you for being here. So I am joined today by an incredible panel of doctors, PhDs, experts. I'm going to let each of them introduce themselves, but we have on the panel today Dr. Anthony Thomas, who is Director of Scientific Affairs at Jarrow Formulas. He's forever a microbiologist in my eyes, a PhD in nutrition science, and someone that I love getting deep into science with. So thank you so much, Dr. Anthony Thomas, for being here.
It's a pleasure.
Dr. Alyssa Dweck, who is a practicing gynecologist who's worked on a multitude of life stages, and I'm really excited to have your perspective here today. I know when we spoke this week, you are focused on the GYN of the OBGYN, but have delivered thousands of babies and really looking at sexual health issues and so forth. So delighted to have you here. Thank you so much.
Thank you.
And Dr. Phillips, and also an OBGYN who's a women's health advocate, and advocate for all women of different lifestyles, people of color. And I'm so excited to get into the science and research of not just different psychographics, demographics, ethnicities, and all the things that we should be paying attention to that we never learned. And I learned so much in talking to you this week. So happy to have you on.
Thank you for having me.
I think that I would, in the interest of time, and I would very much love for you to pepper in your background as in, within this first question as well, but I'm going to dive right to it. And one of the things that was so eye-opening for me, as there are three really traditional vaginal health issues that either I've experienced personally, or I know sisters, friends, people that have experienced some of them with chronic issues. And I've always thought that they were completely separate. Or I'm gonna out myself here. I was saying I'm 46 today, and I had, in terms of vaginal health issues, I certainly thought that a UTI was related to perhaps not going to the bathroom after sex, or the way your uterus was positioned, or Candida maybe related to being allergic to gluten, or BV was something I wasn't familiar with until I was pregnant with my child. And one of the shocking statistics is, even with BV, 30% of women will get BV, 80% of them won't even know that they have it. So for me, the statistics were massive, but the thing that was such an interesting common denominator, which I'll let each of you sort of address or demystify, is that they're all related to microbiome and pH balance, or at least as I studied them, I'm like, am I the first woman who's finally realizing this? And I know we're opening up to a microbiome conversation over the past several years in general, but this weighed heavy on me of like, what is the direct connection? Because especially when I know people that have one issue over the other, and sometimes stubbornly so, is there a connection? Is there not a connection? And I'm just going to start it off with you, Dr. Phillips, and then we'll go across.
Yeah, thank you. So because this issue can be so complicated, I would say in general, there can be a connection, but it's important that women are evaluated, because I find when women come to my office often, because the openings on the vulva are so close, everything is just the vagina. And it's important that women understand the urethra, the vagina, and the anus can all have different conditions that, because they're in close proximity, may overlap, but are often treated differently. And so it's important not to conflate them. It is accurate that a lot of the time, all of these issues can be traced back to the microbiome and the pH of the vagina, but it is important to note that we treat them all differently. They all have different etiologies or origins. It could do anything from how you take care of your vagina, how you bathe, the clothes you wear, things that you introduce into that space, including soaps, lubrication, douches. So while in the end, yes, it can all relate to the pH of the vagina, it actually is a very complicated system that each woman should address with their physician individually.
So I will, before we get to Dr. Dweck, because I want to hear also your perspective and think about, we have everyone on this call. We have almost 1,000 people on the call today, which shows you how interested in so many topics, and we've received so many great questions, but a lot of it related to life stages and pH, which I want to touch on. But before we get there, Dr. Anthony, can you share a little bit from a science perspective of the different effects? Like what does science tell you as a nutrition scientist and someone who studies pH and probiotics? Like what does the science tell you as an expert in the field relative to pH balance and different women's health issues?
Right. So admittedly, this is an adopted area of interest for myself, and I've read about the science related to the vaginal microbiota. And the one underlying thing in common is, like you mentioned, the microbial communities, right? We have these microbial, highly complex communities colonized in various body surfaces, and they differ between the anatomical sites. So most people think of the gut microbiota, but the vaginal and urinary tract has its own microbiota that differs from the gut in composition and function. And the microbes there essentially serve as the first line of defense against other microbes. And the conditions you mentioned are generally perpetrated by other microbes. Over 80% of urinary tract infections I've read are the result of uropathogenic E. coli. And again, not all E. coli are bad, but this particular type tends to be bad. Whereas BV looks to be an imbalance of microbes colonizing the vagina and characterized by a relative lack of lactobacillus species and more diverse community. And this has consequences for health. But as Dr. Phillips mentioned, it's multifactorial as far as all these common lifestyle factors that impinge on influencing both the pH and the microbial community, and whether or not the outcome will be bacterial vaginosis or urinary tract infections, because you can have a lack of vaginal lactobacilli and not have BV. So there's many factors that come into play, and one of the connecting factors is that all these conditions have microbes in common.
With those microbes, in fact, there's a question that just came through, which I'm just going to have you clarify because it makes sense right now. Is that the lack of the lactobacillus in the vagina or the gut? So do you want to clarify in terms of?
Sure, I apologize. So the vagina, unlike the gut, where diversity is generally associated with health, the vaginal microbiota commonly is dominated by one or more lactobacillus species. And so you have a predominance of lactobacilli in the vaginal microbiota. Not always, but this is the vast majority of reproductive age women. And from my understanding of it, there's good reason for this, and they tend to serve a very protective role, generally speaking, although there's specific types of species that may be more protective than others. And so their presence within the vaginal microbiota and also their activity there, one of the most important activities is the production of lactic acid. So the vaginal pH is inversely related to the concentration of lactic acid, meaning the higher the concentration of lactic acid, the lower the pH, which is not very conducive to the growth of many undesirable microbes. And so when you lose lactobacilli abundance within the vaginal microbial community, the lactic acid levels drop and the pH can rise. And now this environment is more conducive to the growth of other microbes that otherwise would be restricted in that region.
And then Dr. Dweck, is there anything you would add with that? And, you know, what I might also, the questions come through, which I think is a really good time just to level set and answer it right in the beginning, is, you know, the difference between BV and Candida, like just like, and I think also Dr. Phillips, it might be good to give a little bit of an anatomy after that as well, which we talked about this week, like, because there are, as we get into questions around hygiene, et cetera, and there's very specific things. So I think Dr. Dweck, related to that would be the differences in pH that you see from puberty to postmenopausal and the journey of pH along that. And also some basics, which I think would be great if someone's asking, like, can you please break down the difference between BV and Candida?
Yeah, sure. And thank you so much. And thank you to the other panelists, because it's great to have this conversation. So I like to simplify this a little bit, just because I know how I speak to my patients, and I just want to give a real shout out to how cool the vagina is overall, because it has an incredible self-maintaining and self-cleaning mechanism that speaks to everything the other panelists have talked about. The vagina, very simply put, has this great bacteria that comes in many strains called lactobacilli. It creates lactic acid, which keeps the vagina in a pH zone that it's supposed to be in, acidic, less than 4.5 pH. The reason I'm bringing this up is because you ask about the difference between yeast and bacteria. And although a lot of people have a lot of difficulty sometimes deciphering what symptoms they're having, most of the time, yeast is in an acidic type of environment, but it causes symptoms that are pretty stereotypical. A thick, white, curd-like discharge from the vagina. Intense itching, that's really overwhelming, distracting, and distressing. Those are the two main symptoms that are present. What's not present during yeast is a foul odor, which brings me to BV. And what so many of my patients want to know is, oh my God, who gave me these infections? And I think it's very important to know that BV is not your traditional sexually transmitted disease. Do not go clunk your partner over the head because you've been diagnosed with BV. That's not what usually causes this, although sexual activity can have something to do with it. The standard symptoms of BV, which is an imbalance of the typical bacteria and yeast that are supposed to be in the vagina, a gray thin discharge, a typically fishy odor that's noticeable to people, although not usually noticeable to people around them, and also itching, irritation, and just a general feeling of swelling. So most of the time these two infections are distinguishable, but not all the time. And this is why we love to see people in the office so that we can truly diagnose what's going on with a culture or a microscopic exam and a history, and treat appropriately. The cool thing about the vagina is it usually keeps things in check unless we introduce disruptors, things that cause serious havoc in the vagina, or on my favorite other cool organ, the vulva, which is all outside, the lips, the clitoris, the perineum, and the opening to the vagina. Because yes, these are all separate areas, but they're, you know, intimately entwined, of course. So I hope that answers your question.
It's amazing.
I call them disruptors too.
Yeah, in fact, I think, Dr. Phillips, if you can give a little bit of like a continuation of that anatomy that Dr. Dweck started, because I think that's really helpful, and even distinguish between the vagina and the vulva. And then,
yeah, I wish I had my model with me today, but I'll use my hands instead. So really what I think a lot of people call the vagina is actually the vulva. And that's the space generally between the thighs that is the mons, where hair typically grows, the labia majora, those are the thicker outer lips that are also hair bearing. When we move in, there are thinner lips, the labia minora, and then from top to bottom, we have our clitoris, urethra, vagina, so this opening is really what we call the vagina if you're in the office. Dr. Dweck mentioned the perineum. It's the space between the vagina and the rectum, and then the rectum. Okay, so it's really important that we actually have an idea of what's going on. And I failed to mention, but I'll mention it now, the clitoris often has a little hood that keeps it protected. So that's what the vulva is. The vagina is simply the conduit that's in the middle of that space, that's there for intercourse, tampons, where your period comes from, those types of things. So anatomy is important. And to Dr. Dweck's point, those disruptors that people use quite frequently, douching, soaps, oils, underwear, your period, intercourse, there can be a number of things for a certain individual. Those are the things that often cause irritation to the vulva, because this is very sensitive tissue. Let me not forget our shaving, our waxing, our sugaring, all the things that we do to the hair down there that contribute to irritation. And so someone comes in and they're like, my vagina's on fire. It actually isn't. It's all the things that we do to the vulva that can complicate the picture for people.
So just because we're like on the topic, and you know, the vagina as a self-cleaning machine, like, let's just go right into the disruptors. I'm sure you've seen absolutely everything. And so, you know, what are the top culprits of the disruptors, or at least the things that you're like, never do, from your personal practice perspective?
I'd say my top disruptors are really people's habits. We, as a nation, didn't really get a lot of education on how to take care of the vulva. So I feel like the most common culprits that I see as they impact the vagina are douching, which still hasn't managed to fall out of favor, even though we repeatedly say that it is self-cleaning. That discharge that you experience on a daily basis that changes, its whitest discharge. People often have a difficult time explaining the smell or describing the smell. That's because it's your smell and it's normal, and it's not offensive. But douching is one thing that we've learned as a way to clean the vagina, which is completely improper. I think the next disruptor that I see a lot of are harsh soaps. Again, the vagina can clean itself. So as you notice throughout the month, the discharge can change. It can be white and creamy, clear, watery, sometimes a little tacky. Again, all normal, but when we introduce soap into the equation, it disrupts this environment, this amazing bacterial homeostasis that we've achieved. And so that's my second biggest disruptor. The other, I would say, is sometimes our underwear. We use a lot of detergents to clean our underwear, and for some women that can be really uncomfortable and cause irritation. And the underwear itself, you know, thong underwear can be very disrupting to some women because it can allow bacteria to move back and forth quite easily. So those would be my top three in my practice.
Got it. Love it. Thank you. And we had a lot of questions leading up to this that you answered right there in terms of what type of
great.
soap or no soap. So thank you for that, because that's important information. And Dr. Dweck, anything you would add there in terms of, I think specifically one question that is related, because your pH is changing based on your hormones and obviously going through so many different life stages, in addition to lifestyle. So we know that we have all the lifestyle disruptors, if you know, eating, allergies, whatever it might be, sex, alcohol, being, you know, more than one sex partner, etc. And so you have all those disruptions, but then you also have just life in general. And I know you have a lot of patients that you've seen through many life stages. So what can we learn relative to vaginal health as it relates to hormone health and life stages? Like, what do we need to know?
Right. So I think what always shocks me is what some women can use with no problem whatsoever, and what other women can't use, and they are literally making a beeline for the gynecologist. Hormones have a lot to do with this. So Birth control, well, I guess I should start with puberty because you asked that. So at puberty, of course, we have now surges and erratic surges with peaks and valleys of estrogen and progesterone based on the irregularity of newly onset menstrual cycles. So that's going to create some changes in vaginal environment. Number two would be, during the reproductive years, and lots of women are on hormonal birth control, which is great in many ways, but also can wreak havoc for other women. So the pill can cause some dryness for some women, and that can be a hormonal issue that can be corrected. I think the thing that I see in my practice the most, because as you all probably know, your practice kind of ages with you while you're in gynecology practice. So during the perimenopausal transition and menopause in general, we see lots and lots of discomforts and difficulties due to the lack of estrogen. Varying degrees that this occurs, whether it's dryness, and dryness encompasses so many different complaints, painful sex, lack of elasticity, a decreased turgor in the skin and in the vaginal tissue. So hormones have a lot to do with the pH disruption for lots of women. The great news is that these things are manageable with whether it's medications or hormones or moisturizers and lubricants or changes in practices. And again, some women can use absolutely anything in the vagina with no troubles whatsoever. Others really have a much more difficult journey, and we really have to manage them individually.
So Dr. Thomas, one question I have, especially, and it's great from your point of view as someone who is like looking at this purely from a science perspective, and, as the also the gentleman on the panel. And so you're not speaking from necessarily personal experience, but, but actually just understanding like the science and Jarrow is incredibly passionate about, science first and everything super tested. So it's something that I think is an important perspective. One thing that was alarming for me, which also explained a lot of everything, is just how quickly the environment can change down there. And so whether it's, and so if you look at life stages, right, or lifestyle, so if like, whether it's exercise, like I know, some of my first challenges were, prior to being sexually active, but being an athlete and like in a hot Southern California and understanding like what the effect might be on pH balance. So what does the science tell us about different lifestyles, whether it's exercise, multiple sexual partners, drinking alcohol? Like there's so many things that I was reading that you can be humming right along and everything's perfectly fine, and then suddenly like everything's not fine, and maybe it's a big night out, maybe it's whatever it might be. Can you get into like how quickly the disruptors are for women, if it's the same for men from a lifestyle perspective, and what the science tells us on how to at least have a first line of defense?
Right, so there's a lot there. Let me unpack some of that. So one thing I'd like to point out is all these various factors that everyone has mentioned on the panel is they're quite common, and these conditions are extremely common. So they shouldn't be viewed negatively, because many women will often experience a loss of vaginal lactobacilli, be it transient, and it's often recurrent as well. And it's in response to these various common factors, be it hygiene practices like douching, sexual activity, so the number of sexual partners, whether or not your partner wears a condom or is circumcised, how many different partners can increase the risk of quote unquote dysbiosis, which is just a term we use to suggest a microbial imbalance. So when I say that with regard to this community, I'm talking about a loss of lactobacillus species and an increased prevalence of let's just say undesirable anaerobic microbes. And so these various common factors are constantly present. Estrogen has a very positive effect on levels of vaginal lactobacilli. And part of that reason is because it induces thickening of the vaginal mucosa and accumulation of glycogen, which is the storage form of glucose. And this is what those bugs will ferment to produce lactic acid. So this is why they tend to dominate the vaginal microbial community during reproductive age, whereas premenopause or prepubertal and postmenopausal tends to be were often characterized by a thinner vaginal mucosa, lower levels of lactobacilli, and increased levels of various diverse microbes. And again, it could be transient, whereas in those states, it's more consistent because you have the loss of estrogen. And so you can have all these factors, and they can lead to various other complications, as the other panelists have mentioned. And maybe a probiotic can help with some of it, but of course not all of it, because there's so many factors at play there. Some research by a prominent researcher in this field, his name is Dr. Jacques Ravel at the University of Maryland. He, I think it was in 2008, published in Proceedings of National Academy of Sciences. And what he found is that the microbial community of the vagina of reproductive age women tends to cluster into 5 core community types. He calls these community state types. 4 of these communities are dominated, meaning one single lactobacillus species represents about 50% or more of all the microbes present. And so 4 of those communities are dominated by lactobacillus species. One is Lactobacillus crispatus. This tends to be seen as one of the most protective. Lactobacillus gasseri and Lactobacillus jenseni. Now, all of those communities are typically associated with health. There's a 4th community that's dominated by Lactobacillus inners. Now, those communities can be present in both health and states of imbalance like BV. And then there's a 5th community state type, and that's characterized by a lack of lactobacilli and more diverse species, and is more likely to transition to a state of bacterial vaginosis. And even independent of that, can be associated with some adverse health outcomes independent of BV. And so this is different than other microbial communities. And so those species are important for the vaginal microbial community. And again, they can shift relatively quickly in response to some of these common lifestyle and health factors, whereas that may not be quite the case with, say, the gut microbiota that might be more resilient to shift, like short-term shifts in diet and whatnot. So whenever the microbial community shifts transiently in women, this can change their risk for various adverse health outcomes, such as a yeast overgrowth or bacterial vaginosis.
Just curious, so with BV, is it truly when we talk about a dysbiosis, like, is it like truly like like just bacteria interacting, basically? So like, and I'm sharing this, I kind of want to break it down because I think there's a lot of taboo around it, or shame, or the perspective that it's an STD, which we clarified right out the bat, that it's actually a disruption of the bacteria in the vaginal tract. Like,
right. Well, I'm going to defer to my panelists on this topic, but I would just like to open with saying that yes, absolutely. Like, I think the term yeast infection is really a misnomer, and bacteria. These are merely imbalances of the microbes present within those communities, and Candida, which is a genus of yeast, and Candida albicans is most commonly responsible for quote-unquote yeast infections, but it's typically present within the vaginal microbial community, however, in a form and at levels that tend not to be problematic, and the lactobacilli essentially keep them in check, as well as some of these other microbes. So they may be present, but they're not causing any issues. Whereas when you lose lactobacilli and their ability to produce lactic acid and acidify the region, well, then your pH increases, and now you have an environment that's more conducive to the growth of other microbes and less conducive to lactobacilli. So the acidity reinforces growth of lactobacilli, whereas the lack of acidity discourages their growth and the growth of other microbes that are already present. So it's not, I don't often see it as infection, but I really want to defer to my panelists on this topic.
I would just say that it's actually a very important point that we start to use correct terminology around this issue. One, to erase some of the stigma around BV and recurrent Candida infections. And it's also an important reason that people should not try to self-diagnose using a 20-minute internet search and actually come see their physician, because to your point, Dr. Thomas, really testing and seeing that this is Candida and the specific types of Candida or BV, and specifically what the the overgrowth is really important and helps us tailor our treatment of your issue, especially if it's reoccurring. The other thing that I think is really important to mention is, yes, in general, all of these bacteria are present in the vagina. And say, for example, I do a pap smear on a patient. Sometimes there's a little note that'll say Candida present. And it's important that women understand that Candida can be present in your vagina at any given time. But if you're not having symptoms from it, we really should have a discussion as to whether this is a problem for you, whether you're internalizing that as a recurrent infection, whereas we really need to have people understand that all of these bacteria are present at all times, playing a very complex symphony as it relates to our vaginal health and discharge. So thank you for making that statement, because these bacteria and Candida are present at all times, but they're not always a problem. Right. And so when we get into this cycle of, okay, it's there, let's treat it. Now I have this, so let's treat it. Well, let's treat both. You know, it really drives us all crazy. And if your vagina and your vulva are happy, maybe we'll just leave you alone. Right. That's not unheard of.
It's an important point. And I think that there's a question I want to ask around just like the signals of are sort of the disruption of, you know, whether it's BV or Candida or a UTI, are they would you look at those as a first line of defense? So, and I ask this from the perspective of, if someone immune system is down or they're super stressed and they have challenges with cold sores, they often get cold sores at that time, or, you know, canker sores, as I think I talked about with one of you on the phone, in their mouth. So the stress is down. Would you look at the vagina and vaginal health as the same marker of your immune system's down or you're having a reaction or some disruption? How would you define that, related or unrelated? Dr. Dweck, start with you.
Yeah, thank you so much. So I think that, you know, maintaining good vaginal health often points back to what can we do to maintain overall general health. So, you know, oftentimes when people have constant or recurrent yeast or bacterial infections, we talk about diet. What can we do to lessen the chances of these infections from a dietary standpoint? So minimize the amount of sugar in your diet. Minimize the amount of alcohol. These are two ingredients that yeast specifically like to feed off of. So those are simple proactive and preventative measures that can be taken. You know, Dr. Phillips spoke about underwear, and I couldn't agree more. The vulva and vagina need to breathe a little bit. If you are strapped down with tight underwear and a panty liner or a pad 24/7, 365, you're going to have a little bit of a disruption there because there's no aeration and a healthy environment for the genital skin in general. So I think choosing underwear that fits properly, that has maybe a cotton crotch. I'm not going to really speak poorly about thongs because I know they're super popular and who has many lines, but thongs can come in, you know, shapes and sizes that fit properly with a proper cotton crotch, so there's some absorbency there for perspiration and any discharge if you have some physiologic discharge, which most people do. Another thing that can be done is during sexual activity is simple stuff. Urinate before and after sex. Urine acts as a mechanical cleanser to the urethra, the opening where urine comes from, in an effort to maybe just flush out some bacteria that may be sitting on the surface from the back and forth and thrusting of intercourse, where bacteria from the rectum may find its way towards the urethra or vagina and increase the chance of infection. I'm a huge advocate of condoms, particularly if someone has more than one partner, because different ejaculate has different, effects on vaginal pH. And so we do know that using a condom regularly can diminish the chance of BV, especially for women who have recurrent BV. So those are just a few lifestyle changes that are easy enough for most people to consider to minimize their chance of infection. And yes, they're all interrelated with pH and the microbiome, but they are all separate infections.
Mhm.
To your point regarding the immune system, no question about it. But is the first thing that we think about when someone comes in with a yeast infection that they have a depressed immune system? Of course not. But someone who's coming in for the 4th or 5th or 6th time in a year, yeah, red flags start to go up, and it's time to start looking for more significant issues that might be impairing immunity in general. So I think, again, this is where the art of medicine and the art of science and facts in basic science really come in handy, and we have to rely on that.
Mm-hmm. Absolutely.
Can I add one quick point to Dr. Dweck and her advocacy for condom use? I just wanted to also mention that women who are in same-sex relationships also should consider condoms for any toys that they might use. That's also important. We're not only talking about a penis here, but any toys that you share in between people, condom use is still really important in terms of these issues.
Mm-hmm. Yeah.
Definitely. And we do know that women who have sex with women have a higher chance of yeast and BV than heterosexual women. So that's something to keep in mind with condom use and toy use for sure. Female condoms are also available. They're a little more cumbersome than typical male condoms, but they are available for those women who feel the need.
We have a number of questions, and Anthony, I'm going to roll this over to you because they are science oriented around the specifics of probiotics, around the, more like getting a little more specific at the differences between like gut, like probiotics that are great for the gut versus probiotics for the vaginal tract. Are there probiotics that do both? Protocols related to antibiotics, which is complex because we have some questions coming in around having a buildup of yeast or candida as a result of antibiotics, but then at the same time taking antibiotics to help them solve the problem as well, or other problems. And what does the science tell us? What are the protocols? What are the do's and don'ts as it relates to at least using probiotics, or what does the science tell us on how to navigate that realm?
Right, so antibiotics comes up a lot. Antibiotic resistance is a major problem in our healthcare system, and it's getting worse globally. And ironically, it's the primary form of treatment for many microbial imbalances on body surfaces, such as a BV or a yeast overgrowth. And it's also a risk factor for those same things, which may be why there's often recurrence. Treatment rates can be as low as 60%, and you don't see eradication of some of these microbes that you're trying to get rid of. Many of the quote-unquote undesirable ones in the vaginal region can form what they call biofilms. And these biofilms can be highly resistant to harsh conditions such as antibiotics or even your immune system's response, so they stick around longer. And these microbial communities, they're constantly interacting. Even good ones, they're constantly competing for resources and space in those regions. So think microbial warfare is going on constantly. And then you mentioned probiotics. So where do probiotics come into play? Now, I just want to remind everyone what the definition of a probiotic is. It's a live microorganism that, when administered in adequate amounts, conveys a health benefit on the host. And so all probiotics are microbes, but not all microbes are probiotics. It's very specific. That definition is drafted in a way to be highly specific, and a health benefit to the host, humans in our case, is a prerequisite to be considered a probiotic. And the only way to determine that is with clinical research, meaning that a probiotic intervention has to be shown to be better than that of placebo in a human clinical trial and for a specific health indication. So it's well understood scientifically that probiotics are strain, dose, and condition specific. And just to let everyone know what a strain is, so humans, we're all members of the same genus and species. So let's say we were a vaginal lactobacillus species, we could all be Lactobacillus crispatus, but we're different strains. Subtle genetic differences can change the functionality. And so not all strains of even the same microbial species are probiotics. So just because it's a Lactobacillus crispatus or a Lactobacillus rhamnosus doesn't make it a probiotic. And they differ genetically, And so functionally, and this has been shown in research, and very few probiotic strains and formulas have been shown to actually benefit women's vaginal and urinary tract health. Now, there's hundreds of products out there marketed towards that indication. So how can that be? Well, remember, there's no legal definition of probiotics, and how they're regulated, marketed, and sold often has nothing to do with the scientific definition. So again, it comes down to the science showing a benefit. And as Dr. Phillips mentioned earlier, because of the anatomy and proximity of the vagina to the colon, that migration of microbial species from the anus to the vagina occurs naturally. And there's a reason why there's no probiotics currently for men's urinary tract health. And that's because of those anatomical differences. They don't tend to make that voyage the same way because of proximity. So the way very select probiotics work, meaning so select lactobacillus species, not all or most, can be ingested orally, survive gastrointestinal transit, exerting metabolic activity and functions as they travel through your GI tract, and also make their way to the vagina and colonize it and displace other undesirable bacteria. And so of those select, there is research showing, again, select lactobacillus strains, typically those derived from the vaginal microenvironment, can be taken orally and increase levels of lactobacillus within the vaginal region and lower the pH. And again, this is conducive to microbial balance in that region.
Couple questions. Does it, is it a buildup? Is this something that builds up over time? And I'm saying this also from the perspective of we have some young members of our audience as well, like through puberty. And like, is there a, you know, I do understand that probiotics aren't something that like immediately necessarily, like we've talked about, like some of the buildup effect. I'm just curious, like what that means for younger, as well as I have questions here from postmenopausal women that is, you know, is there a specific species or strains related to different life stages, puberty or postmenopausal? Does that make a difference or not?
Well, there are, as we mentioned earlier, with regard to changes in estrogen levels, but just I'll stick to the probiotics part and let my panelists address some of the other issues. But with regard to probiotics, I want to dispel a common myth, and that is that probiotics are these just good bacteria that you just take to kind of seed into your gut and vagina to increase beneficial levels. There's no research showing that in these, at least in adults, that using a probiotic will sustainably colonize any of these regions. I mean, they're essentially transient residents that have certain functions, and they interact with your endogenous microbial communities, and by doing so can influence their composition and function. But generally speaking, they don't stick around. Some may colonize transiently, some may do it longer than others, particularly if you were pre-exposed to antibiotics, but they don't just stick around forever. It's your endogenous microbial community, and that's primarily dictated by your physiologic state, your health state, your lifestyle, your environment, your factors. So again, probiotics are something, they're just one tool, and they interact with your microbial community.
The one question, Dr. Dweck, that I would love for you to touch on, and then we're going to open it up to questions. We have questions that are rolling through, but I want to encourage everybody. It's a great time to have your questions answered as well. But related to sex health, which I know you have, your practice goes pretty deep into all sorts of sexual health issues, medically speaking. And, you know, what role does pH have, and, you know, on major, you know, life factors? And I guess part of that might be whether that's fertility or infertility, or speeding up menopause or not. Does it have any role in that? You know, just anything related to, you know, as well as, or pain during sex, or any of these indicators, like what do you do with some of these symptoms that come in? Where do you guide people? And I'll give us all the disclaimer of none of this is intended to be medical advice. Like, please check with your practitioner for every question that you have. And I'm just happy to be talking to experts and at least demystifying some of this, so you can ask even better questions to your practitioner in the future, which is, you know, my highest hope. But I know sex health is a big question. You know, a lot of these issues disrupt, sexual pleasure or confidence, and what are things that, how do you treat these different issues as it relates to that?
Right. So I think an altered pH with subsequent association with infection or irritation can make the difference between an enjoyable sexual experience and a miserable one that makes you want to then avoid it going forward, which is a problem for lots of women. So sexual pain really shouldn't happen. I mean, some women are going to have discomfort from time to time, and that is acceptable as long as it's not recurrent and persistent. But an altered pH, whether it's from an external irritant like a super fragrant soap or detergent that might be irritating you as an individual, or from the fact that you have a super low estrogen level and your tissues have become very delicate and inelastic, and the pH is altered, predisposing you to infection like BV, those things can cause sexual pain. So how do I normally approach this? Well, first, I like to find whatever the offending agents are. Sometimes it's as simple as finding that, the panty liner you're using has a fragrant on it and it's causing irritation. So we discontinue that offending agent and voila, everything seems fine. Sometimes it is more complex. We spoke about checking for infection. I personally do an actual culture for people to discern whether there's yeast, and if so, what strain is it? If there's BV, and if so, offer varying treatments. If there's trichomonas or some other STD going on that needs treatment, and believe me, this happens plenty of times in postmenopausal women who have found a resurgence in their dating lives for whatever reason. So we will treat infection. So those three things can be addressed and hopefully be very beneficial to a positive sexual experience. Oftentimes it's as simple as low estrogen related to menopause. And I know that there are many feelings of controversy surrounding estrogen replacement, even just minimally absorbed in the vagina. So when we want to leave estrogen off the table, yes, or if people are uncomfortable using estrogen, I usually turn to a really great moisturizer and lubricant for the vagina to help those tissues better accommodate comfortable sex. And I could speak for hours on that subject, but suffice it to say a moisturizer is something used more chronically to help, like skin cream. We use face cream every day to moisturize our faces. We probably should be doing something similar for our vaginas if we're suffering from this type of symptom. Lubricants, on the other hand, are used on demand. So more used like I'm going to have sex now, I'm going to have a lubricant available to facilitate and enhance my pleasure. So that's something that's helpful. I'm pretty liberal with estrogen use in the right person if there's no contraindications, and that in and of itself may help to correct pH. I do often recommend probiotics geared towards feminine health to assist with overall general maintenance of a healthy vagina if needed. Some people need nothing, but others really are relying on any external sources that could be helpful. And then, of course, as we've spoken about, multiple times already, really alter your regimen. Laundry detergent, fabric softener, soaps and washes, bath bombs. I'm a less is more kind of gal when it comes to my advice in this realm. So less fragrance is usually better for women who are sensitive. Some women can use anything with no trouble whatsoever. So, really, again, it's an individual situation.
Anything you'd add to that, Dr. Phillips? Or, one thing I would just add in there too, like that it'd be helpful to hear. I'm going to combine a question to have you tack on to that, because there was a question here that we talked about earlier this week. So I think it'd be really helpful for people. But some people that have chronic BV, I guess for clarification purposes, is let's say they have one partner, but every time they have intercourse, they're having an issue with BV that they're not able to eliminate or what have you. What is there a solution? Like, does that just mean that their bacteria is in collision? Is that the way it's going to be? How would you like what's the first step in a situation like that?
So this is someone who with the increased incidence of BV, I would really approach from multiple levels. We keep going back to behaviors, and it's because we can't underscore enough how your behaviors can affect your health. And so with someone like that, I would, as Dr. Dweck mentioned, not only address the sex part, but the underwear and the detergents and the bath bombs. With intercourse, I would also address issues, assuming a heterosexual paradigm, of whether there's semen in the vagina. Maybe that is something that could be eliminated. If there's condom use, that could be addressed. If there is condom use, I often find women in their 20s, 30s now learning that they're more sensitive to latex and they never knew they had a coinciding latex allergy. So all of these things are important. I do recommend for someone who is that symptomatic treatment for the BV, because it is, you know, psychologically and emotionally troubling for them, and it does have impact on the relationship. But this would also be an instance where a probiotic would be helpful for someone who maybe has a chronic issue as a tool for their overall health. Again, some women can do whatever they want to their vulva and vagina and they're fine. But if there is definitely a strong group of women, you like look at the vulva and it turns on you. If this is one of those women where every sexual experience results in BV, this is someone that I would consider probiotics as an adjunct to her otherwise antibiotic therapy.
One question that came up for clarification that I think there's two things, and one of them I'm just going to acknowledge because Dr. Dweck, when you were talking about I'm going to, even though it's not the topic for today because there's so many questions, I just want to address that what Dr. Dweck was saying is that there are creams for the vagina that are different than lubricants, and particularly for menopausal, postmenopausal environments. Is that accurate? Just because I think that there's some very specific questions around postmenopausal issues and you know, did she mention moisturizer? Is that
okay? Sure. So again, vaginal moisturizers are like face creams for the vagina, meaning they're used on a regular and chronic basis to maintain moisture in the vagina. Lubricants, on the other hand, and I guess this is a matter of semantics for me, but lubricants are more like an on-demand use for during intimacy. I think estrogen comes in the form of a cream, a ring, a tablet, an ovule. That is different than a moisturizer. So I do want to distinguish that, because vaginal estrogen, whatever form it comes in, whether it's cream or something else, is not for everyone. And that is definitely something that'll need to be clarified with your own healthcare provider, because it's contraindicated in some women. I will also make a big push for using your vagina, because if you use it and it gets aroused and it gets engorged with blood, whether you're on your own or you're with a partner, the blood flow itself has medicinal purpose. It enhances the natural lubrication that the vagina can produce. This has never been more important than during the menopausal time, when estrogen levels are low and people need assistance with this. For women who are comfortable using toys, vibrators can serve a really great purpose to enhance blood flow to the vagina in times of dryness and discomfort. And while some of my patients feel very much opposed to a vibrator, oh my God, that's really a bad thing, I try to frame it in that instance as more of a medical thing with medical benefit to enhance blood flow. So all of these things are things we have in our war chest to help with comfortable and pleasurable sex. And of course, treating infection, BV, and yeast on the top of the list are necessary if they're there.
right? Yeah, that's great. No, hopefully you improve the lives of all the postmenopausal or menopausal or all the women on this call, for sure, in validating that. So we only have a few minutes left, and I think that this has been an incredible conversation. Hopefully it's been helpful and useful. It's the beginning of many. Again, thank you to Jarrow Formulas. This is a company that's been around for over 4 decades. I'm not sure Jarrow himself may even be on the call. Like, really, I'm blown away by the science and the passion for the science that this company has, and bringing in the experts. So I'm just really happy to be having this conversation. What are, like, you've mentioned a lot of basics. Was there anything that we didn't talk about? And, you know, specifically, we've talked a lot about the vagina being a self-cleaning machine, but I don't know if we specifically said soap, no soap, oils, no oils, water, water. Like, is there anything that's like the clear do's and don'ts? I did hear that douching is definitely something that disrupts the pH balance. Is there anything else in the disruptors, the myths, anything you'd like to make sure that this audience is aware of?
I would love to add that, and I have a feeling Dr. Phillips will completely echo my sentiments. Women know their vaginas. Okay? We've had it for a long time. We know what our vagina is supposed to feel like. And yes, there will be alterations from time to time where we question and maybe even get on Dr. Google, but most of the time things swing back to normal for us, our normal. So if somebody is having an issue where their normal is no longer occurring, it behooves everybody for you to go get it checked out. You know, go visit your gynecologist or your nurse practitioner or whomever you normally see for your gynecologic care, because guaranteed they have heard your issue before, and it's not going to come as any big, huge surprise. We speak vagina. This is what we do all day. So, you know, I welcome people to just really take ownership of their V areas.
And notice probably, and I'll let you speak, Dr. Phillips, but I'm gonna say, like, you notice, to your point, you know your vagina, so you know when something's slightly off, right? Like that's the.
Yeah, I was going to say something very similar to Dr. Dweck. I want to empower women or anyone with a vagina to understand that you have the capability of taking care of her very well, very well. You've had her for a while, you know when things get off, you know what your triggers are. So listen to your body. A lot of the things, the ups and downs with having a vagina, some of the things we self-inflict, some of the things are spontaneous. So listen to her. When you go and you have that bad wax and everything blows up, listen to her, because your body is telling you something. And generally, they don't lead you down the wrong track. So use your healthcare provider to help navigate those valleys when you're not really sure what's going on. That's what we're there for. We're not there to minimize or dismiss your concerns, because I tell you, I've seen it all. We have people come in with so many things inside the vagina. I mean, really, it is just an amazing organ. But I really want to empower women to understand that you can take best care of your vagina by just listening to her.
Thank you.
Katie, I see a number of questions about probiotics. I thought maybe I could close with a quick clarification on probiotics.
I think that would be great. Yes, just in terms of the strains, the species, and which ones specifically related to vaginal health.
That's right. So there's many products out there, and they generally are in a pink box and provide a laundry list of random lactobacillus species and are marketed towards women's health. Unfortunately, there's no science to support those, and I can tell you the top selling quote-unquote probiotics for women's health have no science to support them. So this leaves women and clinicians looking to practice evidence-based medicine wondering which probiotics are effective. And all I'd say is this: look for probiotics that have scientific evidence of benefiting the health outcome that you're looking for. So vaginal and urinary tract health. Actually, I shared a study with you recently. It was published just this month, and it was a prominent researcher in South Africa, Dr. Joanne Passmore. And what she did was she took a lot of commercial probiotics marketed to women's health in South Africa, and she tested the strains in there. And she also took vaginal swabs and tested the strains she got from the vaginal swabs. And what she saw was they behaved very differently. And most of the probiotics tested didn't have strains that performed well. And in fact, strains that originate from the vagina typically are most appropriate for that region. And so look for products that have vaginally derived strains and no other strains, not gut strains, not other strains that can be. You can take a separate probiotic if you want to address gut health. There is no all-in-one probiotic as far as we know.
Can you go deeper? Can you, because there is a question related to that, can you re-emphasize the difference or how to take them together or separate if there is a protocol?
Right, and so I would just say you could stagger your use. You could take one in the morning, one later in the day. Generally, I recommend probiotics on an empty stomach, but don't worry too much. If it has an enteric-coated capsule, this is an artificial protection against stomach acid. So that one you could take without worry at any time. But I just wanted to focus, there are resources out there. There's the US Probiotics Guide, which highlights clinical applications of probiotics, but very few select ones. And I can tell you for women's health, there's only 2 probiotic formulas recommended. One is a 4-strain combination that represents the predominant lactobacillus species found in a healthy human vagina, and that's Jarrow women. I know it sounds self-serving, but then there's 3 other products. It's a 2-strain probiotic combination, and they provide those strains in different doses, but are different products, but they all contain the same 2 strains. In fact, one of those products is also a Jarrow Formulas product. So we like our science. Without the science, it's not a true probiotic for women's vaginal and urinary tract health. So look for the evidence and ask the manufacturer. If it's marketed for that, there's contact information. They should be able to show you evidence of benefit for the select strains in their product.
Great. Thank you for that. And we'll also follow up with more additional information that relates to, both from Dr. Dweck and Dr. Phillips and Dr. Thomas in terms of the science and also just tips and tools and, just expanding on this conversation. There's, one thing I can say that I've learned, which is how little we actually know about so much of it. And so leaning into the science, because there's so many different strains and species that you might think would work, but actually aren't tested to do so or collide or different things happen. So the beginning of scratching the surface, but I think that what we all know is that, or the most important thing to take away is there's a very specific species for the vagina that over 50%, of the vagina, needs to maintain a acidic, perfect environment or perfect is relative, but perfect for you, and that there's a specific species related to that versus different for the digestion, which is really an important thing here and people have asked in terms of the interaction. So with that, I think we'll wrap it up just a couple minutes after, but also right on time. So if you ask questions that were not answered, we will be following up with you directly, but I think we got to a majority of the questions, but we're happy to go into greater detail or connect you with Dr. Thomas, Dr. Phillips, or Dr. Dweck. And thank you again. Have a beautiful week and to be continued.
Thank you all.
Thank you. Take care.
Thank you. Bye.